Yes.
Muscle and bone health. Jano,
Yes.
what's that all about?
I mean, Dr. Joshi is here to tell us. I love how you confidently ask me, what is that about? I'm focused on that menopausal area. So he'll come and confirm this data from Kenya Medical Research Institute in 2023 that said a quarter of postmenopausal women live with osteoporosis. But he will explain.
What's
it is in my interest because it's any day now. I'll be in that category.
Wow.
Trying to look ahead.
Dr. Kartikeya Joshi is an orthopedic surgeon. He joins us for this conversation. This is just for us to ask questions and learn.
True.
Dr. Ari, thank you very much.
Thanks for
joining us.
inviting me. I think it's a crucial topic we should discuss. We are mostly dealing with non-communicable diseases like diabetes, hypertension, obesity, but we are neglecting musculoskeletal health. I think government should come up with health policies treating these problems, which are very commonly seen and neglected. It's a silent killer, I will say. Osteoporosis, poor muscle health and balance leading to fractures and all.
That's a big one. How we normally start our conversations with our guest is Janet will give you a quote and let's see whether you agree or disagree with that quote and your reflection of it.
It's a no pressure moment.
Yeah.
Chimamanda Ngozi Adichie, who's an award-winning Nigerian author, once said, "The problem with stereotypes is not that they are untrue, but that they are incomplete." What do you make of that? Have you experienced that when it comes to stereotypes, maybe in the field you're in?
So yes, stereotype. I think it's important that I particularly, I'm a stereotypic person. I usually follow what I do, and I am passionate about it. Yeah, that is what I will say. I'm proposing. Yes, this is I follow. I'm pro to this quote. Yeah.
Okay,
Thanks.
no problem.
Very much for it. Let's begin with just understanding your work. Talk to us about orthopedics, what it is as a a field of study and a field of medicine, and also the offshoots, I would say, because we were talking about like a
Rheumatologist, yes.
And yes, so walk us through this field of medicine.
So orthopedics, we deal with bone, joints, muscle, tendons, injuries and health. Preventive medicines. Being a surgeon, I usually in my daily clinics, I look at different kind of diseases, prevention methods, and treatment in the form of conservative management or maybe a surgical management. Regarding the offset, yes, there are many overlaps. It's a team approach. It's not always surgery is what you look at, but you also take help from your colleagues like rheumatologist who deals with multiple joint and soft tissue problems. We do consult them because there are certain medications which has to be taken long term and maybe lifelong, where the role of rheumatologist comes. Not even this, I even tie up with gynecologist dealing with perimenopausal, because there are many other back pains which are related to gynecological issues, which has to be dealt with a team approach together with the gynecologist. Yeah.
Okay. You called it a silent killer. Just walk us through that, because that's a big statement. And I think I'd read something from the World Health Organization that says musculoskeletal conditions affect 1.71 billion people globally.
Yeah.
Yeah, so and then it says that it's remained largely invisible. So talk to us about this silent killer, silent crisis.
So if you see that early days is like young days, below 25 we are active, we are doing all the activities. Leave aside the children who are nowadays inside, indoors, mostly on gadgets because of the schoolwork. Sometimes now it's changing from books to gadgets. So they are not exposed to proper activities, muscle training and bone health. After 25, I will say till 18 you have 90%, 95% of the peak bone mass. At 25 it's maximum 100%, and after the age of 40, perimenopausal or after the age of 15 men, it reduces, and it presents as fracture after the age of 50, and or bone pain or muscle pain or joint pain. So it's a silent killer because initially you don't realize, but when your muscles become weak, your bones becomes to fracture with simple falls. So that's why we call it a silent killer. You don't know initially during last 2 decades, everything is fine. And then suddenly you say, oh, why am I having this bone pain, muscle pain, or suddenly I have a fracture with a trivial fall.
Right.
I get patients in my clinics who are lean and thin, very fit, but they say, oh, I got a fracture. Why? Because they have been working mostly sedentary, sitting inside their closed environment, not exposed to sun, doing dieting, lack of proteins, lack of calcium diet, and lack of sun exposure. So these are the reasons. So these are silent killers, and it is, I think, more important than cardiac diseases because we are not moving. So we should come up with something called movement, regular stretches. As we are sitting here, we should get up in between, stretch out. I saw you all stretched out between 2 sessions. So that is more important, and it helps in building the muscles and making the bone strong.
Well, sorry, I'm just thinking about this body, right? And those things that you've talked about that you deal with: bones, tendons, muscles, joints, soft tissue.
Yeah.
You know, every time we think about all these, you think about it's joint issues or some bones, depending on what you do for a living. If you're a footballer, then you're going to think about your joints and all. Are there areas of concern for a surgeon such as yourself that you see people don't actually bother about? Like, people don't even think about their muscle.
Yeah.
Unless you're going to the gym to build a muscle. Then the rest of us are just, we don't think about. Are there things that you think we don't think about that are critical?
Yeah. So it's a good question. People mostly do a sedentary and they think going for weekend gyms will work out. It doesn't work out. So I will say doing at least 2 to 3 times workout is important. Even if it was 20 to 30 minutes is also very good.
Why?
Because what happens first 2 to 3 weeks, when you start doing exercises, you feel that feeling of rejuvenated. You feel good. Yeah, I am doing something good. My body is is working out. Yeah. So what happens? Your nerves, they stimulate the muscles and they stretch. They have minor strains. Then your muscle gains that memory. Yes, and they regenerate. It's known as adaptation. So after 4 to 6 weeks, you develop bulk. So in men, usually it is bulk, and women have a myth that I'll become bulky if I start doing gymming. So it's not true because there's the testosterone levels are not that adequate to lead to bulky muscles. So I think both men and women after 40s, men also after 40 should start doing exercises because muscle, as you work out, they help in building the bones which are making it stronger and preventing future fractures. Yeah.
Okay.
What's a workout?
I was gonna ask.
Yes.
And realistically, in our lives,
Cardio.
it could be cardio, could be stretching.
So I was about to say,
Yes.
because cardio is for cardiovascular health,
Right.
Yeah.
but does that help with muscle health? Because again, something that you hear, women go to the gym, yes, but women specifically anywhere in their late 20s to early 30s should start lifting weights.
Correct.
Is that
Correct.
true?
Absolutely true. So workout, we just do treadmill, some cardio, but weight training is important. Because when you do weight training, as I said, there are stresses happening at the muscle fibers, micro stresses, then they heal and then they make the muscles strong. When the muscles become strong, it's like an internal bracing to the joints and the bones. The bones become strong. You get less of joint pains. So workout, yes, after 40, you should do muscle training exercises, strengthening, weightlifting. If that is not you cannot do. So you don't have, in rural areas, you see in up countries, they don't have this facility. Most of the people, because of the work, they don't get time. So what you can do is simple exercises, just push-ups, wall slides. You can do chair rise exercises, calf pumps, that is holding the walls, going on your toes up and down, that also helps. So all these are your weight related. So your weight is actually helping you gaining those muscle strength and making your bones stronger.
That's helpful.
My body is the weight, right?
What is the weight? You see, there are many apps which show instead of doing weightlifting, you can just use your weight to gain and make your bones stronger.
I think that's really helpful because the first thing is always I don't have access to that equipment.
Exactly.
So what can I do?
I don't have time
And I don't have time.
to, so you've taken a subscription to a gym, you don't have the time to go to a gym.
And you don't do it.
And here is Daktari telling us that going to the gym once a week is not good enough.
So start at home.
Straight.
Start with
Start
what's
at
there.
home.
Yeah.
So even 5-minute stretches,
Yeah.
morning and evening is also important. Daily 5-minute stretches will help you.
Yeah. You had mentioned earlier, and whether you're now seeing these issues present in younger patients
Yes.
because of sedentary lifestyle. So I guess I'm trying to figure out how do we do this with children? What do schools and parents and all these
Yeah.
people need to engage? Because if you tell them, I try and be like, go play, go run. They're like, we played and ran in school.
Yes.
I'm good now. On the weekends.
Yeah.
How concerned are you about what you're seeing in children? And then what do we need to be talking to them about to start maintaining that bone and muscle health?
Yeah. So it's a good question, and it's something to worry about. Like I see my kids, my daughters, they come home after study and they switch on the
Yep.
laptops or TV and they sit in front of it. We have to push them out. We have to push all the children, all our neighbors, so that they can go and play. So what happens? First of all, if you start with the children, school going, they have bad posture. They have heavy bags. Their bags are around 30% more than their own weight.
30% heavier.
30% heavier than their own weight. Yeah. Secondly, the way they are now mostly working on laptops, so they have a laptop posture sitting like this. Yeah, mobiles. So they develop shoulder neck pain, which I see very commonly in children. Coming to adults who are office goers, doing desk jobs, they have this issue: backaches, shoulder pains. Poor ergonomics, the chairs are not good, so they develop backaches. Then elderly people or who are not doing weight training, so after 50 they start developing osteoporosis and develop these bone pains, muscle pains. So my first agenda to all these patients or recommendation is to start doing muscle training exercises. Even if you sit on chair, you should start doing certain exercises to improve the muscle strength around the knee joints, so your pain goes away. So even from Boda operators, they have knee pains. Yeah,
Is it because their knees are
Knees always
consistently
bend, yeah.
bent?
So they get knee pains. And office workers, they have backaches or neck pains. This is very common. So right now, leading problem is a back pain and knee pain, what we see in our clinics.
Our director Jackso is actually concerned about this, and he's asking, so what's the right posture and how long? He's a director right now. He's the one who's doing all these things that we are on air, and he's wondering. So I have an 8 to 10 hour shifts on a daily basis. We have a live transmission throughout. I've got to be seated there so that I can control. So what is it? Should I be taking breaks and just stand up and sit down? Is it okay? Should I, be leaning back? Should I be slouching? Should I be leaning in? How do I sit throughout this 8 to 10 hour shift?
So all sedentary lifestyle is 8 to 10 hours shift. So they are sitting like this. So what you do, as I saw between two, you all came out, you stretched. That is very good. So after 1 hour, you should get up from your chair, which called as stretch breaks. You should take that. Do some stretches, maybe even while sitting also you can do grip strength. This is also very good. When you're sitting down, you can lift your calf up and down. That also helps. And like sitting posture, you should have a good ergonomic chairs. Not sitting upright, but yes, having a comfortable one.
You can ask quietly.
Immediately so sense that we're all like,
Imagine throughout the interview.
Something not. So anyways,
so
having something.
not upright?
Yeah,
not exactly upright. You don't have to sit in a military position.
Okay.
Bringing your muscles in spasm and having that at the end of the day you are having a lot of backaches. But something like which is comfortable, supporting your arch at the back arch, and there are various chairs available. We tell all the office workers that you should have a good ergonomic chairs, which help you in sitting in a proper posture. Yeah.
Okay.
And 8 to 10 hours you're sitting, you have to take stretch breaks. There is no other alternative. That's the best alternative.
The ergonomic chairs are expensive though. I don't know if a lot of people have access to them.
You can do some modification, buy some cushion which are comfortable, putting behind your back and sitting on that. Yeah, that
Okay.
also helps. Yeah.
So essentially, what's a good guide for say so every hour wake up, and I think that's usually even like Apple watches will be like, hey, wake up,
Time to get up.
walk for a minute.
Yeah.
wake up.
But then
Get up.
yes, it's very aggressive. Or get up,
Not wake up.
get up.
Just get up and walk. You're gonna go.
I was gonna say, are
Guide.
there any other like guides? So you've given us, for sitting, make sure you have a little bit of, you support the arch of your
support the
back.
arch of back,
So it
yeah.
doesn't have to be like military upright,
Yeah,
but
correct.
at least the back,
Right.
the arch is supported. But throughout the day, other hacks to just basically get your bone and muscle strength in the right level, at the right level.
So if I say, if you start your day, you should start your day with normal stretches. At least 5 minutes is also okay. If possible, go for running, weight training. If not possible, do push-ups, wall slides, calf stretches, calf raises. These helps in building the muscles and the stretching the bones. If you have a gym a day, you can go for gymming. Weight training is important after 40. Coming to work, when you're sitting, try sitting on a good chair, so that if not ergonomic, make it comfortable, put some cushion, some support at the back. Take breaks every hourly. So if you're doing 8 to 10 hours job, you have to take breaks. There's no alternative.
Right. We have a call on the line, but just before that, I do hear, again, with medical information, there's always so much coming at you at the same time that running is hard on your knees. Is it bad or is it just hard on your knees? But like, what level of running is good? What level of running may be a strain to the
So
knees?
there's a myth that if you run or you do walking, you will degenerate your joints. The joints will become bad. No. You are actually strengthening your muscles around the knee joint. That is the quadriceps, which is a very important muscles. Quadriceps, hamstring muscles, so front and the back muscles of the knee joint. If you strengthen them, it's an internal bracing. They brace your joint and your joint pain goes away.
Okay.
It reduces your weight. It reduces the other non-communicable diseases like diabetes, hypertension. So it is interlinked. It reduces the obesity. So obesity also causes damage to the joint because of the overloading. So walking is good, brisk walking is good. You should do low impact activities. I don't say now, if you see pickleball is coming up, I'm getting a lot of patients with knee injuries, shoulder injuries, because they just start playing without any warm-up. So warm-up is also important.
Okay.
You got
Just
it?
hold your thought for 1 second. We have a call on the line, but we'll come back to low impact, high impact exercise. I think it's Nancy on the line. Good morning.
Warm-up is also important. Okay. Let's hold this thought for 1 second. We have a call on the line.
Good morning.
Huh?
Nancy on the line. Good
Hi, Nancy. What's your question for Daktari?
Okay, mimi, I just have to explain.
Nancy, punguza volume ya TV kwanza, tafadhali, ndio tukupate, ama radio,
Sawa.
whichever you're listening on.
Hello?
Aya, punguza volume ya TV ama radio,
Unanisikia sasa?
nakupata, yes.
You're still there in the
Yeah, the
background.
Okay, now we can hear you. Aya, what's your question for Dr. Joshi?
Niko na shida ya miguu iko weak.
Uko na?
Miguu iko weak.
Nancy, I don't think we can get you quite clearly. Just try one last time. Uko na nini?
Nasema miguu iko weak.
Ah, okay.
Alafu chini ya miguu inaganda. Of which magoti pia siwezi squat.
Huwezi squat.
Kuamuka ni shida. Nasikia iko weak kabisa. Hivyo.
All right.
Unataka daktari ya kuguide. Okay, sawa. So she's saying pain
In her
again in the knees, in the joints,
Her feet
can't
even.
squat. Yeah. Did she,
She
say
said
also
miguu zimeganda.
miguu
That's what I
zimeganda.
heard.
Like that tightness in
Numb
the
tightness, yeah.
in everything.
So I don't know what her age is and what kind of problem she's suffering from. There could be various of reasons. So assuming she's having a early osteoarthritis or late osteoarthritis, advanced osteoarthritis, it affects the joints. It leads to deformity and they have severe pain. The muscle goes in spasm because they are not aligned. So they can have this kind of tightness or pain. So in such patients, I tell them not to do certain activities which will increase the pain. They can do low impact activities. They can do aquatherapy, swimming, walking in water. If they don't know swimming, they can do wall slides. That is
walking
assisted.
in water.
Walking in water. It's a very nice exercises. You can do close chain exercises. That is using resistance band. Then you can do is wall supported squats, mini squats. If you not possible to do deep squats, because deep squats also affects your patellofemoral or the kneecap and the femur or thigh bone pressure. So all these are the things, small modification you can do in your exercises, and that does helps. Yeah.
But I think you should also need a full consultation to figure
Exactly.
out
To
what's
gauge, yeah.
okay.
You wanted to know about low impact.
Yes, low impact versus high impact exercise. Again, the information online comes
It's
at
a
you.
lot.
It's a lot. It's
Okay.
like, okay, don't run, it's bad for your knees. Run, it's good for your heart.
Yeah.
Do pickleball, do paddle, easier than tennis. It's so please give us a guide.
So
guide,
right now, if I say pickleball is in, there's so many centers opening up, and people start doing exercises. They just start playing. They start getting tennis elbows. They get shoulder pains. They get knee pains. Like I played last time without warm up. I even have a knee pain. So I said, let me do some warm up and then start. So it's very important to do and train your muscles and start playing aggressive games rather than going for immediately. If people have any kind of knee pains or arthritis or any joint issues, they should go for low impact activities, or like I said, swimming, close chain exercises, gym trainer, and most important, doing exercises in under supervision is more important than just going and lifting heavy weights.
Okay, when you don't have... We have Albert from Nakuru. We'll take his question just before we go into the break. Good morning, Albert. Do you have a question this morning?
Yes, good morning.
Good morning. Go ahead.
Yes, so I'm calling. I have an issue on my chest. I got an injury while working. We do a bit of lifting of feeds. So during work, nilipata injury on my left upper towards the collarbone, where it connects with the sternum.
How long ago did you get this injury?
It has stayed almost a year.
Okay, did you go to the hospital, Albert?
No, I haven't gotten some proper checkup from a specialist, but it goes on and recurs. Anytime I'm working with trying to lift, I do feel pain on that side.
Okay.
Yeah.
Albert, what we'll do, please make sure you just stay tuned in, because we're going for a short break. When we come back, Dr. Joshi should be able to, maybe he'll ask a few more questions or just give you some advice. So just stay with us so that when we come back, we're able to address your question. It's coming up to a break. We'll come back. There's a lot of people asking different questions. We'll see how many we can answer or we can have answered. Fixing the Nation, one conversation at a time. Back in a moment. Involve me, choose me.
Involve me.
The Aggie 254 says, hey, plug us with ergonomic chair sellers in Nairobi, please. Staki Mapepe says, I totally concur with Dr. Joshi. We can improvise on workouts at home to cut costs on gym charges. Is working in the shamba like plowing enough of a workout? Yani kulima na jembe. Yes, enough of a workout, but then posture.
So, upcountry, they're working mostly on the farms, bending long hours, affecting the knee, lifting something heavy. So they have this neck pains, shoulder pains, and the back pains. Obviously, knee pain is also there. So degeneration or arthritis sets in faster in these people, rural area. Urban is because you're not working out. So your muscle wasting is there. So you develop as bone pain. So it's all
sides of the
related.
same
Two sides.
coin.
Do we go to Stanley Mutunga before we come back and answer Albert's question?
Yes, I think so. He's on the line. Let's just get a question from Stanley Mutunga, then we'll answer Albert and Stanley's as well. Good morning, Stanley.
Yes, good morning to you.
Good to hear from you. What's your question for Dr. Joshi?
I'll express myself in Swahili.
Aina shida.
Sasa nilikuwa nataka kuuliza, swali yangu ni it just happened one day, just in the morning, nikaanza kusikia mkono moja iko inashindwa kuinuka. Na that thing has traveled across the mkono kuenda mpaka mkono mwingine. As per now, I can't lift mikono. Lakini before there, wakati niliona inazidi, nikaenda kwa daktari, napewa mandawa. At the end of it, nikaenda MRI. Na sasa ikaja kuwa there is a certain nerve in the spine. Inaweza hiyo inamea, inaweza hiyo ndio inafinya nerve hiyo yani
Mshipa.
body kana inafinya kana hiyo nao inaweza kuwa the cause. Sasa nilikuwa nauliza daktari, is there any medicine inaweza kuwa taken apart from kufanywa operation, kwa vile ikiwa sasa ni nerve inatakiwa inafinywa ni mpaka itolewe?
Right.
Stanley, how old are you?
Yeah. Hey, I am 72.
Okay.
Sawa.
Na unasema sasa mikono yote mbili, are you saying you're not able to raise both arms completely, or are you having difficulty raising the arms?
In the morning there was a very big problem today, even to wear a shirt. Kwa vile I can't lift my mikono yote miwili ndio sasa niingize shirt. Sasa hiyo ndio shinda ile inanishinda sana. Mwili ikiwa unashindwa kufanya chochote kile ya kuinua, actually it is a problem.
All right. Let's hear from the doctor.
So, 72. He says one day he woke up, noticed one of his arms, couldn't quite lift it, and then it went to the other arm, got some medicine, and then got an MRI, and he was told that there's essentially a bone sitting on a nerve.
A pinched nerve.
Impinging. Yeah. And he's asking if there's any other treatment options that are non-surgical interventions.
Right.
Yeah.
So, Mr. Stanley, thanks for the question. From the history, I recollect that it is mostly your cervical canal or cervical spine problem, and it is related to the nerve impingement. So, if it is significant, you should take a urgent surgical management, because it can lead to severe weakness in the arms, and as you realize, you are not able to hold a cup of coffee, or things are falling down, your handwriting changing. These are the warning signs, red flag signs that you should go for surgical management. If not, these are not the ones, and you are having a muscle weakness, or power is going down, it's not that significant, you can always try for physiotherapy, that is muscle strengthening exercises, but it's better to consult your doctor who is treating you and follow his advice.
Okay. So he says the doctor has actually advised that he does surgery. So he's calling to ask, must I do this surgery? He had difficulty putting on his shirt this morning.
Yeah.
He must, because it sometimes leads, the cervical spine, the cord is quite crucial, and if it is pressed for longer hours duration, so it can lead to myelomelistic changes. That is a physiology of the flow of the goes away, and it becomes irreversible. Okay. So you should undergo a decompression and certain surgeries which helps in faster recovery.
Before we take the next caller, there was a caller before the break.
Yes, Albert.
He was talking about he does a lot of work that is lifting weights.
Yeah.
And then what was it about?
He said he got an injury, something between the sternum and
And
the collarbone.
yeah.
And he's not gotten any medical intervention so far. But every time he goes to work, attempts to lift, it's pain.
Pains, yeah. So regarding his problem, it could be most related to injury. So there's something called sternoclavicular subluxations or dislocations. Sometimes it becomes, because of the injury, it can become loose, it can subluxate. Whenever he's lifting any heavy object, it moves and it causes pain. If it is not related to sternoclavicular, if it is related to the shoulder joint because of the injury, or heavy weightlifter, we have commonly seen something called DCO, or distal clavicular osteolysis, in which the bone becomes a little edematic and porotic or weak, and they also develop osteoarthritis or AC joint osteoarthritis. So these are the problems which are treated by modification of weightlifting or some medications, physiotherapy. If not, then surgery.
Yeah. I know we have another call. I'd be interested to find out at what point do you go from managing the pain to it shifting to surgery? Like, when do you need to, start managing?
Right.
We have a caller on the line, Jack. So remind Agnes. All right, Agnes, good morning. Tell us a little bit about the question that you have for Dr. Joshi today. Agnes, unatupata?
Yeah.
Okay.
I think I can explain myself na Kiswahili.
Endelea.
Nilikuwa nauliza about nerves. My mama akona shida hiyo ya nerves miguu. Kuganda na muscle pull. Ya mguu, anajaribu she can't even lift up mguu, and for painful. I think you can imagine the pain she lies down helplessly, crying. And there is no way I can help her. Na tumeenda hospitali, akienda anaambiwa ni nurse, anapewa madawa, and it's about 2 years now. Na bado haja change. Na that hiyo nurse imehama kutoka the other leg ikakuja kwa mguu mwingine. So I was asking, kuna dawa yenye anaweza tumia? Kila saa ameenda hospitali anapewa dawa asaidiki. So nilikuwa nauliza daktari kama kuna dawa specific anaweza tumia ili hali apate kupona.
Okay. So just hold on the line. So she says her mom has an issue in the leg, like a nerve that is quite painful.
And has spread to the other leg.
Yeah, she says now it's spread to the other leg. Been to several doctors, gets medication, but none of them seem to be alleviating the pain.
Okay.
Yeah.
So it could be spine problem, that is lower back or the lumbar region, where there could be nerve compression leading to radicular pain coming down to the legs. It has a tingling, numbness. It's related to the spine, and if it is becoming worsened, that is because of the age. Degeneration happens, and it leads to impingement. The treatment we start with the physiotherapy, medications, rest. If it doesn't go away, then it's a surgical. That is, you have to release those compression on the nerve so that your pain goes away. Sometimes
so she says that she's been getting medication, but it's not alleviating. Is it because there's no physiotherapy? What should she look into next?
She should look for the look for the physiotherapy, and there's something called intermediate. That is, she can take for she can go for injections. So we do nerve root blocks or epidural injections, which helps in reducing the inflammation around the nerves, and it relieves the pain. The radiating pain goes away. And then obviously physiotherapy is one of the crucial part to strengthen the muscles, because back pains we have seen because of the weak cores. So you have to do a core strengthening and your back pain goes away.
Yeah.
So it's all interlinked.
I wonder how accessible a lot of these services are. It's probably another question that you'll come to. Edmund from Elgeyo Marakwet is on the line. He also has a question for Dr. Joshi. Good morning, Edmund. I hope you can hear us. What's your question for Dr. Joshi?
My question is, I have a problem in my spine. I have a problem in my spine. Na nilifanyiwa MRI. Kaambiwa some parts of the mfupa imekulana. Na nauliza daktari kama, na nikaambiwa nitafanyiwa surgery. But I never accepted kama kuna other means of treatment.
Okay.
Kando na surgery.
Iyo mgongo kukulana, did the doctor use any other term?
Iko chini ya hapo kwa
posterior
hip. Yes.
Alitumia jina ingine ya kuexplain iyo mgongo kukulana.
Kuna medication alinipea kwa sababu alikuwa ameniambia nitafanyiwa surgery.
Okay. Ni vile tunajaribu kutafuta jina ya kizungu hiyo mgongo kukulana. Because sijui
daktari tu anaelewa, aliandika sio L1 2 3 4.
L1 2 3 4. Okay. So
uko na miaka ngapi, Edmund?
52 years.
20?
52 ama 22?
52 years.
52. Okay. Thanks, Edmund. Yes. So, I think it's, he says his spine, L1, L2, L3, L4 vertebrates. I think kukulana, merging or something, trying to figure out a translation for that. And the doctor recommended surgery. Again, he's asking if there's any non-surgical intervention. Yeah.
So, if you look at a non-surgical intervention, it is always physiotherapy, medication to relieve the pain, certain medications to help in reducing the nerve-related pains. If it is merging, I think he's talking about degeneration, that the vertebrae are rubbing against each other, so there is no space left. So obviously it is pressing on the nerves. The intervertebral disc or the cushions between the two vertebrae or the bones, they desiccate. The water content goes down, they becomes degenerative, and the vertebra starts rubbing against each other. If he's not having any neurological problem, that is, there is no paraplegia, paraparesis, or loss of muscle power, he can always choose for physiotherapy as an alternative method of management. But if it is really leading to these red flag signs, he should go for surgical.
Okay. So Edmund, I hope umesikia, if kama ina affect your mobility, kusongesha mkono, miguu, then surgery ni lazima.
Unless uko na physiotherapy.
Yeah, but kama hizo, if it's not, aina shida zingine za movement kwa mwili, then I think you can go for physiotherapy. Just to, to paraphrase.
Which again, we'll find out how accessible these are. We do have another caller. Sorry, say that again, Wangeshi? Nick. Okay. Nick is on the line. Nick also has a question. Oh, okay. Nick,
hi.
Kama unatupata, uko na swali kuuliza Dr. Joshi?
Yes. Hi. First, let me say I'm a huge fan of fixing the nation, but today I'm saying we are fixing the body. and I had a question. Yeah. I am a stage 3 nasopharyngeal carcinoma survivor. 2 months into remission. I've done
congratulations,
9 chemotherapy sessions and 35 radiation sessions. And in the process, I'm having some weird muscle pulls, especially my right side. I can find my neck locked to the side, whereby it's like I have a pull to the neck, and at times my jaws can lock when they are open. And I have an issue with my right, like when I drive or something, or I just sit for long, my left shoulder blade also locks up. So I'm currently on magnesium glycinate and vitamin B complex supplements. But I don't know if Dr. can tell me what else I can do.
All right. Just again, for some of us who may not be medics, you said stage, you're done with chemo and...
stage 3 nasopharyngeal. For layman's, we can say cancer yamapua.
Yamapua. Thank you so much. And congrats again for being in remission, and wish you all the best in the recovery journey. But let's have Dr. Joshi answer your question.
He has a nasopharyngeal carcinoma and underwent this treatment.
Yes, so, and now his jaws lock, shoulders, etc. Yeah.
So we have seen such problems, but it could be postural, positional. Physiotherapy is the answer to this. Getting it correct posture, strengthening of the muscles around the neck and the shoulder joints, the scapula. Some scapular set exercises which will strengthen and correct your posture. These pains or the locking or spasms what you are having should go away.
Okay. Yeah. He mentioned supplements. How effective are supplements in this?
Because of the medications you develop and because of the low protein, low diet which has low vitamin D, vitamin B12, you can have such deficiencies. So it does help after certain age. Because of malnourishment or malabsorption, we advise to start supplements because your diet is usually not adequate. You eat what you like, but you don't eat a good proper diet. So supplements are necessary. So supplement does help. Yeah.
So maybe take them early. Should we just start as a solution?
Should we self-prescribe supplements?
No. So I tell all my patients, how long will you take these supplements? So you should get your blood test done, necessary blood test done. Sometimes we do a DEXA scan or bone densitometry, which helps in knowing how fragile your bones are, osteoporosis what we call, or osteopenia, and accordingly we treat those with medications, with their different kind of medications, and they have to be taken for certain durations, and then we again do a holiday, that is we stop those medication, test again. If you see that you are deficient, we maintain on certain dose.
We have Leland on the line as well. A lot of calls clearly coming through. Let's get to hear from Leland. Good morning.
Good morning.
I thought it's Lilac. Sorry, nilisikia Leland. Good morning, Lilac. What's your question for Daktari?
Yeah, my question for Daktari today is, I have a problem with my muscles. I've been taking medication, but so far there is no changes. And then I also have problem with my bones when I wake up in the morning or sometimes after a long walk. I have my bones break, like they have this sauti, you know.
Mm-hmm.
Yeah, so I don't know what to do.
How old are you, Laila?
I'm 50 now.
50?
Yeah.
All right, so let's hear from Doc.
It's a common problem that we see, crackling of the joints. Yeah. So especially the knee joints, when we say we are squatting, we are getting out of our chair or vehicle, you hear those sounds. So these are some of the age-related changes. What you develop, the nourishment of the cartilage goes down, the water content goes down. They develop something we call as a fibrillations, or we develop some lines, or there's a defects, and then they become painful after some time. Mm-hmm. So the first treatment for these are exercises, strengthening the muscles. There are certain regenerative medications we implement in our practice, is intra-articular injections. You must have heard of PRP. Then there's a viscosupplement. These are similar to the, like viscosupplement is similar to the synovial fluid which is found in the body, in the knee joints or other joints. So we supplement those so that patients have less of these symptoms. If those crackling sounds are very painful, you should consult a doctor, get your x-rays done, maybe an MRI, see how bad it is and treat accordingly.
We have like 5 minutes.
Yeah.
Let's go a little bit into diagnosis. Is it bone density tests? What kind of screening is there for people to know that their bones and muscles are either good or not good? What does that look like?
So bone density we advise after certain age of 40, and especially in ladies who are going into perimenopausal, you should undergo bone density so that you know whether how strong your bone is, like hip or distal radius or the wrist bone. You must have, people fell, they have a wrist fracture or hip fracture, they make you disabled, you are dependent. So better getting it tested. And if it is very low, that is it's going in the range of osteoporosis, it has to be treated with certain medications. In people who are indoors, they are required to do physiotherapy exercises, avoid certain sunscreen which I've seen, like a SPF 30, it reduces the absorption of vitamin D or sunrise by 95%. So that is also important.
I tried to tell someone this and they gaslit me.
That one I can't lie. I need to process that for a while. But how accessible are these, doctor? We've had a lot of the callers. You know, by the time you're getting to surgery, obviously they're at that point where they're either thinking, I can't afford surgery. So what does prevention look like? How accessible are services like yours across the country?
Just before he answers the prevention one, on the sunscreen one, what's a good guide? Because essentially you do need protection, but also it does prevent the absorption of vitamin D. So what's a good balance between getting sunlight and enough of it and protecting your skin?
So we call it a safe exposure of the sun. That is, you should not get yourself burned. But yes, in African countries, we have seen dark complexion requires 3 to 5 times more exposure to get that amount of sun vitamin UVB. So UVB is essential for vitamin D formation. And we wear long sleeves. We are not exposed to sun. We are sitting inside. Maybe from the glass you can see the sunrise is coming, sunlight is coming, but you are not exposed because UVB don't cross these windows. So you have to get yourself exposed. So mostly it is morning time, 10 o'clock, when you should go out and stand in sun, exposing your arms, forearms, so that it is even 15 minutes of exposure is very good for vitamin D formation.
And this is sunscreen free?
Sunscreen free.
Yeah.
Yes.
Okay. Now, accessibility to services and the kind, how accessible are they?
I think we need to reach out. This now government comes here as a health policies. They need to have a movement as walking, doing stretches in the offices, bringing it policies that this is mandatory. In rural areas, it's difficult to get physiotherapy exercises or this. So community health workers comes into play, where they should reach out, like in churches, community halls, mosques, where these facilities, or at least community health workers should educate people how to do those exercises, how to prevent these problems in future, so that like in rural areas, bending forward, doing activities, they are doing too much of stresses and damage to the body, as opposed to the sedentary life workers in urban areas. So this is a balance and education, what I would say, to prevent. Reaching out, yes, finally, if community health workers see that these are the problems, they should be referred, then referral pathways comes in the play.
Okay.
Yeah.
And when we think about the preventative care overall, and you've given us some of the hacks from a policy perspective, just as we close up, you've talked about community health promoters. Is there anything else that could be done from a much bigger policy perspective?
Yes.
Aside from the referral system?
Yeah, so if we look at the policy, government should come up with the school screening programs. In office screening for women to post-pregnancy.
It affects so many people. So thank you so much for shedding such incredible light. That's been Dr. Kartikeya Joshi. Somebody is asking, how can you be reached? It's where you plug yourself, Doc.
I can share my number or my clinic number.
Okay, do you want to share your clinic number now?
I can share.
Okay.
07111 011 71. The clinic goes by the name of Joshi Surgical Specialty Center.
Okay.
It is located on 3rd Parklands opposite Aga Khan.
All right.
So the number again?
07111 011 71.
Okay. Good luck with fielding calls today.
Yeah, it's going to be a busy day.
All the best. So from talking about bone and muscle health, in a moment we'll be talking about Beyond the Hype, how streamers are changing media. Again, the iShow Speed Africa Tour has become a huge conversation, but what more is there to it? Omar Hamed will join us in just a moment. It's coming up to 9 a.m.